Hello, and thank you for joining our short webinar on the 2025 Medicare KX Modifier and Targeted Review, brought to you by Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on Medicare, Medicaid, TRICARE, and a large selection of private payers. We offer our members billing support such as policy and claims reviews, assistance with appeals and prior authorization, and keeping up to date with policy changes for no additional cost. Members can email us at any time with any compliance or billing questions or arrange a phone call. We also offer comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. Check it out at therapycomply.com. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. In 2024, the KX modifier threshold was $2,330 for PT and SLP combined and $2,330 for OT services alone. Next year in 2025, the amount is going to increase to $2,410 for PT and SLP combined and $2,410 for OT services. When the expenses incurred for the patient's outpatient therapy services for the year have exceeded one or both of the KX modifier thresholds, therapy providers must use the KX modifier on all claims for subsequent medically necessary services. By using the KX modifier, the therapist attests that the services above the KX modifier thresholds are reasonable and necessary, and that the documentation of the medical necessity for services is in the patient's medical record. Claims for outpatient therapy services exceeding the KX modifier thresholds without the modifier attached will be denied. The KX threshold applies to therapy services provided in outpatient settings that include private therapy practices in office and home, the offices of physicians that employ therapists, skilled nursing facilities under Medicare Part B, outpatient rehab, CORFs, and outpatient rehab facilities, outpatient hospital departments, and critical access hospitals. Key points: the KX modifier is only for patients that have traditional Medicare. Medicare Advantage plans have their own billing rules and typically do not require the modifier. In fact, I've never seen a Medicare Advantage plan that requires it. The modifier applies to all therapy services the patient received over the year, not just services provided by the current billing therapist or group. If the patient is new, you should check the MAC to see if the client has exceeded the threshold. In 2025, the targeted review threshold will remain the same at $3,000 for PT and SLP combined and $3,000 for OT alone. Under the established targeted review process, some but not all claims exceeding the MR threshold amount are subject to review. Medical reviews involve the collection and clinical review of medical records and related information to ensure that payment is made only for services that meet all Medicare coverage, coding, billing, and medical necessity requirements. Once claims reach the $3,000 threshold, the reviews are not necessarily going to happen, but the chances of it are more likely if the following factors are involved. The therapy provider has had a high claims denial percentage for therapy services or is less compliant with applicable Medicare requirements. The therapy provider has a pattern of billing for therapy services that is aberrant compared to peers or otherwise questionable billing practices for such services, such as billing medically unlikely units of services in a day. The therapy provider is newly enrolled in Medicare or has not previously furnished therapy services. The services are furnished to treat a targeted type of medical condition, and the therapy provider is part of a group that includes another therapy provider identifying using the factors described above. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.